Welcome back to the Pentland Auditorium. For those of you here in the room, I hope you enjoyed your lovely lunch. And for those of you joining us online, thank you very much for being here with us. I just wanted to show you a purchase I bought, an ITAKOM candle. Absolutely lovely. So downstairs in the Cromdale Hall in the ITAKOM Hub, you can buy an ITAKOM candle and £5 goes towards Salveston Mind Room. So a little plug for Laura Thomas there. But welcome back. We have got our first of our big talks this afternoon, and I'm delighted to hand over to Judy Wagner to introduce our speaker. Judy.
Thank you very much, Jane. Well, welcome back from lunch, everybody. For those of you online, it was curry and ratatouille, and very delicious, so hope you've enjoyed something delicious and nutritious at home as well. I'm Judy Wagner, as Jane said. I'm a trustee on the board of the Salveston Mind Room Centre, and I'm delighted to introduce our keynote speaker for this session, Dr. Nancy Doyle. Dr. Doyle is a chartered psychologist in organisational and occupational psychology, and she's the founder and owner of Genius Within, which is a social enterprise dedicated to facilitating neurodiversity inclusion. She's also the co-founder of the Centre for Neurodiversity Research at Work. Now, my day job is in executive search, and this is an area that many of our clients are focusing on at the moment. So we're delighted that Dr. Doyle is going to talk to us about neurodiversity and employment, where we've been, where we're going, presenting an overview of the neurodiversity and employment sector since the advent of disability inclusion legislation, with a critical overview of successes to date and her own thoughts on the future. So, Dr. Doyle, you are most welcome.
Okay, so you should be able to hear me coming through on the, is the microphone all working? Good. They said, will you stand still at the lectern or will you be moving around? And I was like, moving. Definitely moving. So hi, I'm Nancy Doyle, fully paid up member of the ADHD Massive. Yes, all in agreement. Hi. Not enough of you, come on. Yeah, late diagnosed, as is typical for women of my generation, because you had to be a naughty boy to get a diagnosis in the 80s. So I've been working in this field for over 20 years. I was a support worker for adults with learning disabilities and autism when I was in my late teens. And what I found is that all the psychologists really annoyed me. And so I decided to be one so that I could argue better with psychologists. And that's basically what's happened. And one of my 17-year-old twins said to me recently, "Mum, have you based your entire career on a grudge?" I went, yes. Basically, yes. So I've worked in around disability inclusion at work. Very quickly decided as a psychologist that I didn't want to do clinical because there was no way little old ADHD me was going to handle working for the National Health Service. I was going to go, it would have been too much. So became an occupational psychologist, very much with the intention of making the workplace an inclusive, healthy place to be. And so I've worked with long-term unemployed people. I worked for Access to Work doing disability assessments, diagnoses and coaching. Got really into coaching, absolutely love coaching psychology. I'm also a coaching psychologist. Started my company Genius Within in 2011 when my independent practice got too much for me and there was more work than I could do. And so Genius Within is now about 200 people strong, and we are 68% neurodivergent and or disabled, and our board is 75% neurodivergent and or disabled. So we are living the neurodiversity at work experience, both as employees, as managers and leaders within a business, but also as consultant practitioners, occupational psychologists, HR specialists. So that's kind of where my experience comes from. So I've got this little graphic that I use to kind of discuss the different levels of inclusion. So there is this level, the level 1, exclusion. This is where, only a certain type of person is allowed in. This is the neurotypical norm in organizations. And if you are in any way unusual, you are on the outside. That is level 1. Level 2 is compliance. And that's what we've been doing since disability legislation came in. So in 1995, we had the Disability Discrimination Act, and that made employers obligated to make adjustments and accommodations for disabled people in workplaces. And then that kind of had a little iteration, and then in 2010 it became subsumed within the Equality Act, which is broadly aligned with the United Nations Conventions on the Rights of Persons with Disabilities, which means that it's not only an obligation to make adjustments for people at the individual level, but it's also an obligation to design workplaces that are inclusive. And that's the bit we don't think about as much. So one thing we've got reasonably good at is compliance. And in the workplace, what that tends to mean is that we've got a bit of a don't ask, don't tell policy. We might, you might want to disclose your disability or a neurodivergence. Most people don't, because they are rightly concerned about stigmatization. And then we kind of don't really do anything about it, but if you have a problem, you can put your hand up and someone will help you. So we're kind of reactive, we're waiting for people to have problems, and then if people do have problems, we might send you an assessor, we might provide you with some coaching, we might provide you with some assistive technology, we might let you do your work more remotely, or come in to work at different times of day because commuting is more stressful for neurodivergent people. In my career doing workplace needs assessment, one of the most frequently requested adjustments was the ability to work at home more. And everyone used to say it wasn't reasonable. It was so, like that was, and then guess what happened? I know. I was like, oh, interesting. That's not going to be so easy to argue anymore, is it? And I write for Forbes, and my most popular Forbes blog ever is the one I wrote in the first 2 weeks of the pandemic, where I said, we are all disabled now, what the pandemic is showing us about the social model of disability. And it was very much about this idea that we all suddenly were thrown into a space where we couldn't work in the way that we were used to. We couldn't do the things, we couldn't communicate in the ways that we were used to. And we all of a sudden had to find new ways to communicate. And what we did in that moment was demonstrate that actually lots of people can work from home really well, actually. And isn't that lovely? So that's compliance. And we're still broadly there. A lot of companies are still doing that. Access to work exists to support individuals that don't work for companies that have resources or intention to be inclusive. And so if you have a disability and you don't have an HR team that will support you, you can go to Access to Work and they will send you an assessor, make recommendations for adjustments, and they'll pay for some of those as well. So there's a way for you to have support at work on an individual basis, whether your company is a good one or not. The other thing that we've started doing, and we do a lot more of this, is deliberate inclusion. And by deliberate inclusion, I mean the kind of autism at work paradigm or the neurodiversity at work projects, where we are deliberately hiring people into our businesses, not because we feel sorry for them. So we've moved on from disability inclusion being a pity project, but we're hiring them because we think that they bring certain skills. So we want people who are neurodivergent to come into our workplaces because of what they can do, rather than because of we feel like we should be being nice. And I feel like that was an enormous paradigm shifting moment when that started to happen. But it is not systemic inclusion. It's not where we need to be going. Where we need to be going is where our workplaces reflect the natural diversity in human cognition, and where we have roles for specialists as well as roles for generalists. And the way it works at the moment is still very, very based on generalist rules. And one of the things that, one of the criticisms I have several criticisms of the autism at work stuff, but the biggest one is, so the experiment was, if we change the way we recruit, could we have some different and unusual people come in and do a really good job? And the answer to that question is yes, that is true. So when we took the interview process away from autistic technologist roles, away from technologist roles for autistic people, we got some people into the jobs. It turned out they were really good at the job. So what should have happened next is we should have gone, yeah, why are we using interviews to hire for this role? Not, let's keep having more projects where we change the rules. Let's just change all the rules for everybody so that we are hiring based on the skill that we need rather than the tradition that we hold. Interviews are a terrible way to recruit for technology roles. You should be doing workplace needs workplace sampling. They're a great way to recruit for coaches. So when I'm hiring coaches, I do interviews because that's the right thing to do for a coach. It's the right skill. I'm measuring the right skill. But when I'm hiring for my finance team, I give them a spreadsheet full of holes and ask them to find the holes. And if they want to call me and tell me where the holes are, that's fine. If they want to write to me and tell me where the holes are, that's fine. And if they want to meet me in person, that's fine too. Because the method of communication is not the important thing about that job. The important thing is, can they find the holes and can they make meaning from data presented in that way? So I feel like the deliberate inclusion stuff is a route. It's a step in the right direction, but it can never be the end goal. Because we're replicating, what we're doing when we make it the end goal is actually segregation, not inclusion. Does that make sense? Yeah, we wouldn't do it for any other form of D&I, would we? Like if we were saying we need more ethnic diversity in this company, we've heard Chinese people are really good at maths, should we go and get some into finance? No one would think that was a good idea. So I think the message of the autism at work paradigm has been A, people have value, and we can do disability inclusion because people have value, and it's really exciting to have its specialists. The second message from deliberate inclusion is that when we changed the rules and we got good people, that should let us know that we needed to change the rules for everybody. So, systemic inclusion is when these are just the things that, this is just the way we do things around here, and we don't put unnecessary barriers in the way of people being able to work at their best. And we can say to people, how can I support you to work at your best? And then those kind of flexibilities are as available as possible. It's kind of like personalizing the workforce. And this is very much in line with where we are in the modern world. So all of this homogenous stuff started in the Industrial Revolution, didn't it? So prior to the Industrial Revolution, specialists worked as specialists. If you were really, really good at fine motor control and you weren't particularly interested in talking to people all day, you could be a silversmith. If you absolutely loved talking to people all day and you were rubbish at fine motor control, you could be a market trader. Or so we had all these kind of different roles that suited different people. Do you know in Tudor times, disabled people were deliberately invited to take roles at court because learning disabled and autistic people were particularly known for being honest and not lying to the kings and queens. And so they were invited to court as in the role of companion so that there was somebody in the room who would speak truth to power. Isn't that lovely? So all of this stuff that we have now, where we think we have to make adjustments, has all come from the period of history that we've been in, within the Industrial Revolution, when we needed human beings to do the same things over and over and over again repeatedly. We needed human beings to be able to read and write. We needed them to be numerate. We needed them to have good fine motor control and dexterity for operating machinery, and we needed them to sit still and concentrate for 8 hours or more at a time in a really busy, noisy, sensory, overwhelming environment. And anyone that couldn't do those things needed to have a label. However, where we're in now, in the 21st century, all of that is changing and work is becoming more flexible and personalised. Personalisation is the paradigm that we're in now. Medicine has become personalised. Medicine used to be homogenous as well. We would find the drug that worked in the same way for the most people, and then that's the one everyone would get. And now we're changing medication regimens and treatment protocols. We're making them personalised. We have personalised media for good or for bad. That's not a debate we can start right now. But you know, if I go onto Google and I want to get the news of the day, I will get very different news to what Judy might get, because we have personalised our information protocols. And this is where the workplace is going. We are going to personalise the workplace, and that's how we are going to find that this stuff becomes less exclusive. But just to remind us, the situation is still pretty dire. So in those 4 kind of levels of inclusion, we still have a situation where only 20% of autistic people have a job, compared to 53% of disabled people on average, and 83% of abled people, as reported by the Office for National Statistics in 2019. 25% of the prison population meet the clinical criteria for ADHD. A third of long-term unemployed people are dyslexic. 33% of autistic people also have learning disabilities, and disabled people learn 14% less than abled people. 70% of the prison population may be neurodivergent and 70% plus are illiterate. So while we're all talking about these lovely programs, the reality for the majority of neurodivergent people is that they do not have access to these programs. And this cartoon, I think, really sums up what I mean by a kind of standardized protocol. So this is what we do. We put everybody through the same process. This is what our school system is like. Everyone has to do the same stuff, you know, because that's fair. And if you look at this graphic and you think, well, what's the actual job? Let's say the actual job is picking apples. Now, if the actual job is picking apples, you don't need to climb the tree. There's only one animal that can't do that job if the job is picking apples, and that's the fish. Everybody else could do it. So by mandating the way we go about creating success and the way we go about measuring and selecting people for roles, that is what has created a lot of the disablement and the exclusion. So that's the exclusion picture. Adjustments, we've got lots of really good evidence. I've got references at the back of this, so people of you that want to follow up for references, please feel free. The adjustments that work on an individual level, schedule flexibility and environmental flexibility, as I've mentioned, coaching to support people with executive functions, coaching for literacy support, assistive technology, workplace adaptation, formal training, and changing the way that supervisors manage the relationship. Those are the things that work, and those are the things that we have evidence that work. I'm going to skip the next slide because I kind of did it all. Actually, no, there's a couple of bits I didn't do. Okay, so I told you about the benefits, changing the narrative from disability inclusion as a pity project to understanding strengths, and job crafting for specialists has been anecdotally successful in terms of performance. However, it may lead to segregation or integration. Not only do we have a limited reach when we approach things like that, we have also got a situation where those places are disproportionately white and disproportionately male. And yes, I have done the stats on that, and here you go. So I did a big survey in 2021. Sorry, touching things that make noise. So I did a survey of autistic people at work. So 576 people, reasonably diverse in terms of sexuality from LGBTQ communities, 75% white, which is less white representation than the UK on average, but given that it went out across the world, it's still not good enough. But we were able to look at some of the differences between the white experience of autism at work and those from the global ethnic majority. Average age 38, age range 17 to 65. We found an awful lot of co-occurrence, as you can imagine, but it's always just good to document these things. And where are we? Oh, can you read that? Is that all right? Yeah. Oh, this is my favourite thing. So I do this in all my surveys. I ask for people who are self-diagnosed as well as people that have formal diagnosis, because we know that diagnosis is privilege. And so if we're only ever doing research on people with a formal diagnosis, we've got biased data, basically. And whenever I do these studies, there's never any difference between the people that are self-diagnosed and formally diagnosed in terms of the outcome variables. We found that white males were disproportionately represented in co-occurrence, but women were disproportionately more co-occurrence of ADHD, dyslexia, dyspraxia, but women were more likely to have been diagnosed with a mental health condition. We found that white males were disproportionately represented in the diagnosed group compared to the self-diagnosed group. And this is one of the other problems with making workplace inclusion about a label. So if you need the piece of paper to get you into the workplace inclusion, then these are the things you're going to find. We also asked our survey participants about their experience of masking at work, and then we kind of split that up according to their demographics. And we found that transgender people were masking 11% more of the time than cisgendered people. Non-binary people were masking 25% more than men. Hispanic people were masking 17% more than white people, and women were masking 15% more than men. Black people were masking 35% more than white people at work. And people from developing countries were masking 19% more than people from the Anglosphere. People without accommodations were masking 60% more, and 20% more if you only had accommodations sometimes. So this is just giving us some really good baseline data about some of the problems we've got in the neurodiversity at work movement. We found that 72% of autistics in our survey who were white were employed, compared to 57% who were Black, Asian, Hispanic, and mixed heritage. The ratio of male to female in autism at work programs was 7:1 compared to the global average of, yes, I'm enjoying your face. Everyone just needs to look at Naomi's face. She's doing the facial representation of the reaction. She's just role modeling the reaction. You should be up here with those reactions. That's really good. And we're hoping that by kind of starting to quantify some of, is anyone here surprised? Anyone? No? Is this like, everyone's like, my goodness, I didn't think this was the case. Of course we knew this was the case, but sometimes you have to diligently go out there and collect the data so that you can have these conversations and start shining a light on some of the inequities within our own stuff. So one of the things that came out of this study that was absolutely fascinating to us as researchers, we asked about accommodations, is the international phrase, adjustments is what we call it in the UK. So we were asking about very specific adjustments. We asked about remote work, we asked about flexible hours policies, we asked about things that we know to be typical adjustments for autistic people, and we asked another question which was about their perception of whether or not those adjustments were tailored to them all the time, some of the time, never. And when we looked at those groups of people and looked at their scores for how much masking they were doing, for how included they felt in the workplace, what we found is that the accommodations wasn't making a difference. What made a difference was whether they felt they had been accommodated or not. So the people who said that they had access to to tailored adjustments most of the time were generally reporting a better workplace experience than the people who said that they had remote work access. Do you see what I mean? So we were like, okay, but remote work access is the thing that you might get. So how come the thing that you might get isn't making you feel happy and authentic and able to engage at work? But the perception is this is of interest. So then we did another survey, Almut and I, my collaborator at Birkbeck, and this is secret. So these data are supposed to be being reported at the Neurodiversity in Business Conference on Thursday. So you all have to pretend you haven't seen this, including the people that are online right now. But a little sneak preview. I know, shh. I'm going to be in trouble. This is embargoed data. But I decided to bring it in because this is now not just autistic people, it's all of the neurodivergent kind of neurotypes that we associate with the movement. And we went into this particular issue in a bit more detail because we were like, this is curious. So this survey is 900, it's nearly 1,000 people, good representation of most neurodivergent conditions. So again, instead of using masking and experiences of inclusion at work, we asked another couple of things. We were looking at well-being, reported well-being, and we were looking at intention to leave. Because from a human resources point of view, the intention to leave is the moneymaker. So if you work in HR, what you know is that your metric that counts is your turnover. If you're spending a bunch of money hiring people and then they leave shortly afterwards, that as an HR person, you're in trouble. That's what you need to fix. So we wanted to specifically look at what supported people to want to stay with their current employer. So this is what happens when you've got adjustments, no adjustments currently in place versus adjustments tailored. So you've got, 49% of people, when they've got adjustments that are tailored to them, are very unlikely to leave. And then if there's no adjustments, 31% of people are saying they're likely to be leaving within the next 12 months. So we're like, okay, here we go. We've got this thing. Adjustments are supporting people. But then we did some hierarchical regression analysis and looked at a lot of the variables to see, well, is this the most important variable? And it isn't. So we asked about staff support, we asked about company knowledge, we asked about tailored adjustments, which is the one you've just seen. We asked about how supportive people's bosses are. We asked about their experience of psychological safety at work, and we asked about career satisfaction. And just to be absolutely clear, this is what I mean by career satisfaction. I'm employed in a job which reflects my qualifications, which reflects my ability. I can advance my career in this company. I have been passed over for development opportunities. That's a reverse coded question. And there is a good chance of being promoted from my team. So the higher the scores were on this, the less likely people were to leave. And this was the one. And as you can see, it's by a country mile. This is the one that was predicting people's desire to stay. And adjustments is in there, but it actually wasn't significant. And in occupational psychology, we talk about one of the things we're really into is motivation at work and motivational theory. And when we talk about motivational theory, sometimes there are things that we call hygiene factors. So a hygiene factor is something where if it's not there, you notice and it's demotivating, but if it is there, it doesn't necessarily bring you joy. So imagine many of you have probably been in hotel rooms. You probably haven't noticed whether the hotel room is clean, but if the hotel room was not clean, you would notice. So you're not going to leave going, oh, that hotel, it was amazing. The cleanliness of the room, best bit about it. Hardly anyone says that. Actually, there might be more people here that say that than normally, but nodding from the front there. But generally speaking, a hygiene factor is something where the absence of it causes you a problem, but the presence of it just puts you at a baseline. And a motivator is the thing that you talk about, that you tell all your friends about, that you get excited about. So what we're starting to think is that actually adjustments aren't motivating. The absence of adjustments is demotivating, but adjustments themselves that's not the only story in town when it comes to neurodiversity at work. So we've lived through 30 years of adjustments. Let's all talk about adjustments. Do they work? Can we have some evidence? What's happening with adjustments? Adjustments are hygiene factors. What's motivating people is the idea of career progression, being heard, having someone to talk to about those adjustments. It's a relational thing, not a transactional thing. So if you have the best list of adjustments known to humanity, but nobody will talk to you about that and consider your experience and value you and think about the things that you do well, now that you've had those adjustments, those adjustments are not going to predict whether that person wants to stay working for you or not. And I think we're now into some far more interesting and nuanced territory related to neurodiversity at work. So I'm just going to go through some of the other things we've found because they're interesting. And I'm hoping that I'm in a place that will find them as interesting as I do, or maybe this is just my geek and no one else's, but I doubt it. So interestingly, when we asked employers, so we also had 130 employers fill in this survey, and we asked them what they were confident about in relation to neurodiversity at work. And yeah, we've got the highest score for supporting individuals and for operating wellbeing policies, for supporting managers. And then you can see career development and succession planning is third from the bottom. So that's the thing that employers are least feeling kind of much less confident about, but it is the thing that will make the difference, which I think is pretty interesting. Another little snippet of data from that study is that both employers and employees are more or less aligned in what they think those strengths are. So I think that's a great place to work from. So if we start pivoting what we're doing for neurodiversity at work much more around thinking about people's strengths and what those strengths look like as a career trajectory. So, and as an example, I'll give you an example of what I mean by that, because one of the issues is that if you look at these skills, right? So creativity, hyperfocus, detail processing, innovative thinking, authenticity. These are jobs that work really well at a strategic leadership level, and they are absolutely pants for middle management. But all of our job kind of models rely on people coming in at the bottom and being specialists, and then kind of you're good at your job, so you get promoted to manager of the team, And then you might be manager of the team for a while, and then you might be like an area manager or a slightly more specialist manager. But generally, by the time you get to a strategic leadership role in most organizations, you've done at least 10 years of middle management or junior management. And middle management and junior management do not want you to be creative. They want you to be compliant. They want you to be good at admin. They want you to not argue with people. And those are the things that, you know, all our leadership careers require you to go through that process. And yet the things that neurodivergent people are good at are the things that would make you good at leadership, but they are the things that would make you not so good at early management. Does that make sense? Yeah. So one of the things we need to be looking at is how do we create career progression roles for specialists? So can we have people at the director level who don't manage teams? I don't manage teams in my company. I can't do it. It drives me nuts. So, yeah, she knows. Sorry, my colleague here is on our board. She's seen it and heard it. So that's one of the things that I think we need to be talking about in relation to neurodiversity at work now, is not just how do we make sure adjustments are in place and that they're effective and we know that they work, but actually, what are we doing about career design? How are we going to redesign the future of work, the future of workplaces, so that roles are more easily personalized, so that working conditions are more easily personalized, and so that we actually have the best people for the right job, rather than this kind of constant, everybody gets a CV, an interview, and some references, CV, interview, references. We call that the recruitment triad in occupational psychology, and anyone here who's an occupational psychologist will know that we have been saying how useless that is as a method of recruitment for 40 years. So maybe the autism at work paradigm is going to help us break out of that process, because it is not the best way to recruit people. So what we need to be doing is identifying spiky profiles. So we all know this concept of the spiky profile. That's my spiky profile. And these are the categories that I use at Genius Within with our kind of, we've done a way of assessing people at the behavioural task level rather than kind of doing cognitive testing as a questionnaire, because cognitive testing is quite intrusive and it's quite expensive. And what we wanted to be able to do was just assess where people felt strong at work and where people feel not so strong at work. So you might look at this, and I think I'm pretty good at spoken language. You've been listening to me talk for half an hour. You might think I'm not. You might be like, shh, Doyle. And I think I'm all right at numeracy. I think I'm pretty bad at self-organising. And again, you might think, maybe not, because, you know, she's got a PhD, she's got 17-year-old twins, she runs a company, but I'm pretty bad at self-organising for what I have to do, if that makes sense. So if I'd done this same profile when I was in independent practice, I probably would have given myself a much higher score for self-organising, because when I was just me that I had to worry about, it was fine. And similar for the whole emotions and sensory, when I didn't have to kind of hang out with all my colleagues all the time and manage their emotions, then it was much easier for me to manage my own. So this is a very much in context kind of thing. And then where I think we need to get really, really cool about managing this, how we're going to do the personalization, this is how we're going to do the personalization piece, is by giving people access to understanding their own spiky profile. And what comes with this is for every question, you've got a kind of strategy of what could support you if that was a weak area for you. So it's matching the top tips that come from 20 years of coaching that I've had with the typical workplace areas. But then the other thing that we do is aggregate this data. So what I'm showing you now is Genius Within's spiky profile. So this is my company's spiky profile, where you can see on average, we've got quite a few people that are good at numeracy and reading. But we've actually got quite an awful lot of people that are not good at self-organising. I'm not alone in that. And that's an area where we don't have strengths. So we've got a lot of people that are struggling with admin, organising, managing time, and we haven't got very many people who are good at that. So now if I look at that as a business owner, I'm going, interesting. So I knew this bit would be true. Social interaction and emotions, 68% neurodivergent disabled staff team. So I knew that would be the case. And we already do a lot to support that in terms of EAP, reflective practice, anonymous whistleblowing processes, mentoring, a lot happens there already. But the thing I wasn't quite prepared for was how under-resourced we were on self-organisation. And so now what I can do is make a decision about that, and I can go, okay, given that I've got that much need in that specific area, maybe I need to hire some people that are actually really good at that. Maybe we need more administrators, and maybe I might think to myself, well, that's quite a lot of money to pay people specifically to, but maybe the productivity boost we'll get as a result will be worth it. So we have actually hired a project manager, but also we're a company full of people that know how to do coaching with people who are struggling with time management, organisation and concentration. So maybe we should just do a bit more of that ourselves. So that's kind of where we got to. So I think what I'm saying is that this idea of the systemic inclusion future, I don't think it's a million miles away, and I think we're developing the tools and the techniques that we need to get there. And partly this is about predicting what needs we're going to have. So rather than waiting for people to struggle and then helping them one person at a time, it's kind of going, we're going to have people. Some of them are going to be good at this, some of them are not going to be good at that. That profile isn't just relevant for neurodivergent people. As a 47-year-old woman, I can tell you that ADHD and perimenopause go together like a dump truck in a nitroglycerine plant. And so, there's a new level of need that has occurred, which I feel like, whether I was ADHD or not, would have had a massive impact on my working memory, my concentration, my productivity. So, understanding that these needs come up and talking about them without making them about medical conditions and medical labels where you don't need a ticket to get you in to get the help, but you just have a company that says, how do I support you to work at your best? What do you need, what do you need to work at your best? Managing by output rather than input. This is part of the shift I think we can do. And then looking at our job design so that when we do a kind of a positive action hiring program for a specific type of person because we think they're going to do well at that job, learning from that immediately and going, right, how do we now pivot to making sure that this whole what we've learned here is applied to everyone so that the undiagnosed people can have the same benefit of flexibility and accommodation. And we need to look at the entire employee life cycle. So this is another occupational psychology conference. Well, universal design is a disability inclusion concept. If you want to read up on it, there's the Center for Universal Design at North Carolina, and they've got 7 principles for universal design of software. Which is fantastic, and I wrote a paper a few years ago about how you would apply those same principles to human resources. So you would do things like, designing jobs for masters rather than just jacks of all trades. So the people that are really good at one thing, let's have jobs for them, as opposed to every job. When you see data analyst jobs and it says must have team match skills and influencing ability. Why? I don't need that. If I've got a data analyst, I want them to be really good at analysing data. I don't really care if they don't come to the pub or if they only speak for 5 minutes in a meeting and then they leave because the rest of it's too overwhelming. I don't care. So, let's design jobs for people that are really good at 1 or 2 things rather than constantly having our jobs for everybody. When we're hiring, we do this. We're hiring for specific missing skills and matching the recruitment to the role. I once had an organizer, I think I'm nearly out of time, aren't I? This is my last slide. A few minutes. Okay, in that case, I'll just tell you this story because it really makes what I'm saying come to life. So I did a project for the Civil Nuclear Defence Force, which is a very specialist police force in this country. Guess what they do? Yeah, it is what it says on the tin. So they had a work sample test as part of their hiring, which was very good. So it was great. And their work sample test was that applicants had to, they were informed about an emergency situation, and their job was to appraise that situation, summarise the most important parts into a short statement that could then be communicated to other forces in the country, fire service, paramedics, in order to call for backup, basically. So how quickly could they appraise the situation, summarise it, send it out for backup? And I said, and what they wanted to know is, did they have to give an adjustment of extra time for neurodivergent people? And I said, well, how are you giving them the information? And they said, oh, well, it's on 2 pages of A4 on a laminate card. And I went, oh, so they have to read it. And they went, yeah. I said, well, in that case, you're measuring how quickly they read, not how quickly they appraise a situation. So what they ended up doing, which I think is fabulous, is they created a VAR headset with a scenario in it. And then the recruits put the VAR headset on, they had a little look around, they could see, okay, there's a shooter up there, there's a small fire over there, there's 2 people down, great. And then they could speak or write into the thing. And then they didn't have to do extra time. They didn't have to make an accommodation of extra time. And what they were doing is hiring people who were actually going to be good at the job rather than the people that read quickly, who I can't imagine would be necessarily that good at the job because it's 2 very different parts of the brain, several different parts of the brain. So I think we can do universal design around contracting. So something that we do at Genius Within, we have a business etiquette policy, which is all of the weird things about work that nobody tells you that you're expected to just discern. So we can get better about how we do contracting. We talk about psychological contracting in OCPSYCH. So there's your actual contract and there's your psychological contract, the one which is the expectations that you have of this job and what you expect from a boss and the expectations that that boss and those colleagues have of you. And we don't always talk about that. And I think if we're going to be neuro-inclusive, that needs to be part of onboarding, is we actually really look at what are those unspoken expectations. Almost all of the cases that I go to where we've got somebody in a real intractable conflict who are headed for tribunal, it always tracks back at some point to some kind of misunderstanding where the employee thought something was obvious or the manager did and the opposite didn't. And then that then frames how the conversations go, things start to unravel. So if we can just be clear about that stuff up front. As I said, I think when we look at training, we can plan training around our missing skills if we knows what those are. We knows what those are. Lost the power of speech. It's only Monday. I've got 3 more talks until Thursday. This is not going well. And performance review needs to be the same as hiring, really. We need to be appraising performance. Oh, I saw, I was supporting a company in America, and all the recruits that we'd been supporting into their ND program they were failing their probation at much higher rates than we were expecting, and we were like, what is going on? Let's have a look at your probation review. And on it, one of the items was, must show compassion in the workplace. And we were like, okay, how'd you do that? How do I do that as a woman, and how does my colleague Adrian do that as a man? Do you know, is it the same or different? And what do you even mean by that? Am I supposed to pick people's coats off the floor if they drop them? Should I be offering to make them coffee? Should I know what kids they have so that I can ask them about their birthdays? Should I not be talking over them in meetings? Like, what does that even mean, must show compassion in the workplace? What a load of old nonsense. So we just get rid of all of that. And then we also need to be neuro-inclusive about the way we do well-being, because well-being issues that come from people being unable to concentrate or having sensory overwhelm are very different to the other well-being issues. And as an ADHDer, I can reliably tell you that if one more person tells me to try mindfulness, I am going to throw something at them. So neurodiverse, inclusive well-being interventions. That's another thing that's come out of that study that I'm not allowed to talk about yet, actually, is of all the coaching topics, well-being was the least favourite coaching topic. So coaching for memory and attention was top, coaching for organisational skills, coaching for time management, coaching for well-being is like down here. But it's because it won't be neuro-inclusive well-being coaching. It will be, you know, la la la, now you will feel better, now you can go to work and be happy. No, you can't. So anyway, I think that's about all I've got in terms of content. And so my slides will be up with the references. And yeah, thanks for listening. Okay.
Thank you very much, Nancy. And we've got time for questions, which is great because they're all coming in. I would say that if you're having difficulty using the app for questions and you need some help, then we've got Nell and Iona down here. So just put your hand up or grab them, and they can either bring a mic to you or they can actually type in the question for you if you're having trouble with the app. So let's go to one of the questions. This question is from Sandy. As a leader, what are the best things I can do to get the best out of neurodivergent team members, and what are the worst things I can do?
The best things you can do is ask them how you can support them to work at their best. So And the worst thing you can do is expect them to have all the answers themselves, because they may not. You know, you don't, when you get your diagnosis, it doesn't come with a manual of all the things that will be easy for you and all the things that will be hard. So, so I think that kind of, yeah, investing in that communication, what we're learning more and more is that, yeah, it's like I said, this is relational, not transactional. So that relationship of trust and people want to be heard, not helped.
Yeah.
I think is the major thing here. So, you know, if you're hearing what people need and you are supporting them in the things they do well and invested in supporting their career around those things, that is the best thing that you can do without a shadow of a doubt.
Okay, that's great, thank you. My workplace says that we can't implement neurodiverse specific protocols because we first need to address disability as a whole. What do you think of this?
Why are those two different things? That's what I think of this. They're the same thing. They're the same and they're not the same thing, if you see what I mean. Neurodiversity and disability are a Venn diagram that have quite big overlaps. And if you do neuro-inclusive stuff, it's going to be relevant for a whole load of people with different disabilities. You know, people don't... Multiple sclerosis reduces your executive functions. So if you have an MS diagnosis, you also have depleted ability to manage time, concentrate, think through prioritization of workload, same as you do if you have ADHD. You know, what we really need to be focusing on is what are the things, what's at the task behavioral level, not which conditions get a pass this week and which conditions don't. Do you know, like this is why I think basing any of the disability inclusion on any specific condition is part of the problem, not part of the solution, because for systemic inclusion, you just have that flexibility built into the system, and whether somebody's coming for that support because they have MS or whether they're coming because they have dyspraxia ought to be irrelevant. It's not your job to know, actually. You don't even need to know. How about that? How about we don't even need to know? How about you don't have to disclose anything stigmatizing to just have the ability to personalize your workspace and the way you work, and, you know, if you're able to do your job well, great.
And a more inclusive management style as
well. Yeah. Well, I mean, this is the thing that's coming out really, is that the line manager relationship is absolutely pivotal. Where when we ask people where they went for support in the study that I'm not allowed to tell you about, the most common point of contact is someone's line manager. And line managers are not well resourced for that. That's the thing. You know, the magical line manager who will be everybody's mummy at work does not exist. Line managers are some of the most first line managers are some of the most stressed out, exhausted people in our workplaces right now. And so I think just saying, well, your manager should do this and your manager should do that. What we should be doing as professionals is supporting managers to be able to do those things by equipping them with tools and resources that will allow them to focus on the relationship rather than worrying about whether they're getting it right or wrong.
Thank you. So somebody was asking about different types of organisations, and they said, have you seen differences between sizes or ownership class, so public, private, etc., of organisation in their ability to offer tailored opportunities and adjustments?
Yes, when this study comes out on Thursday, it will be freely available for anybody to download. But there is a few of the we captured organisation size, and we have diced up some of the outputs by organisation size. I mean, there are about 10 academic papers in that study. It's probably going to take me another 3 years to start drawing it all out and publishing it. But larger companies are kind of interesting. They're better resourced to provide flexibility, but they're also more entrenched in routine and rhythm. And so it can be harder to get things done. And then you have a kind of situation where half the company will do it like this. And, you know, so you can get lost in that very easily. Yeah.
Okay.
So yeah, there are...
You would like to ask a question. We've probably got time for one more, I think.
Thank you. I'm really new to this area, so I'm really interested in how the use of diagnostic or clinical conditions is making the change, because I'm hearing in a way partly that we need to get beyond them to change the workplace. But also I'm hearing that a lot of the activism and the consciousness of those conditions has been quite transformative of the workplace. And I just wonder if you can give your sense of how that movement is going. Can we get beyond them yet?
Possibly not yet. But yeah, so for me, what we need to be doing is flipping the model. So at the moment, we have a gatekeeping situation where you have to get the magic ticket that lets you through the gate, to where you can get flexibility, support, and generally what you need. And actually, a lot of what you need is pretty standard. That's the issue. So having been someone who's been making workplace needs adjustments recommendations for over 20 years now, the things that I end up recommending are the bloody same over and over and over again. And it's just kind of, it feels really pointless to spend a lot of the money finding out whether or not that person should have that favour. I mean, this is true, I think, for children as well in schools. I was working with Portsmouth Local Education Authority on Friday. They've stopped because they've got so many kids that they're waiting to get assessed. They've just gone, we just can't wait. These kids need help now. And so they've published a book of ordinarily available adjustments and given it to all the teachers and say, try this stuff. Just try this stuff. Doesn't matter whether the kid's got a label or not. Just try this stuff. Which, yes, absolutely, yeah. And that's what my work profiler does as well, and where we're using that in organisations, they are reducing the cost of assessments, because a lot of people go, oh yeah, I can do those things, great, and then they don't need anything else. And that's, not everybody is like that. Lots of people do need things that are more specific and more specialised, but if we can clear out a whole layer of need. The other thing that I think being that kind of task and concrete behaviour focus and adjustment focus first does is it puts power back into the hands of the individual. So I think there's something, and I say this as someone who's been through this myself personally, there is something kind of a bit disempowering about needing to be assessed. Then you get given a report, and most people write reports in a way that is unintelligible to the human eye. I'm sorry about that. I apologise on behalf of my whole profession. I'm really sorry. I do lots of work in the BPS to try and stop that. But you get this report, and it's basically saying you've got a condition that you can't understand, and you can't even read the report, and now all you know is that someone needs to help you. And that's it. It's like, okay. You know, it's not empowering, is it? Whereas the whole kind of, well, hold on a second, let me see, where's it working well, where's it not working well? Are you doing those things well? That's great, keep doing those things, that's fantastic. These things you're struggling with, can you try any of this stuff? Yeah, I can try some of that stuff. I don't think it's going to do everything, but it might do something. Like, the individual is immediately engaged in the process, and they've got agency in that process. And so that's where I think it's transformative. That's where it's into the paradigm shift, yeah. Okay.
Well, I think we've run out of time, but Nancy, thank you so much for sharing all your knowledge and experiences and hot off the press research.
I know.
So shh, mum's the word. Very grateful to you. Thank you very much indeed.
My pleasure. Thank you all for having me.
Super.